errors in cancer chemotherapy can lead to huge losses, most importantly loss of patient. It can also lead to loss of confidence in the hospital, confidence in the treating doctor, physician and the paramedical staff, and most importantly it can lead on to the medical legal unwanted vicious circle. So let us see how we can reduce this chemotherapy errors. The first and foremost important thing is to accept that chemotherapy errors occur. This is the most important thing. So we should recognize what is the scope of errors, where all errors can happen, and accept that errors can happen. To err is human. And the next point is to see how we can reduce it. The most important thing I feel is to have a patient identification systems, which any JCI accredited hospitals do have. They have a specific UHID number and they have a band which the patient carries, which states his name, his or her name, UHID number, age. So patient identification system is very important. Now why is this important? Because two patients can have something in common. Some names can be common, only the surnames are different. So there should not be any mistakes in administering the wrong medicine to the wrong patient. So identification of patient is the foremost thing, very important. Secondly, now let us come to the pharmacy. The very important oncology pharmacy is something which is totally different, and there are many levels of check usually seen in any good onco daycare setup. Now usually the chemotherapy orders, they are written by the doctors and counter checked by a pharmacist who is trained in oncology pharmacy only. Now during the administration of chemotherapy, each nurse has to sign the chemotherapy administration and it has to be countersigned by another nurse. Now very important in the chemotherapy chart is the name of the medicine, the dose, duration, the dilution and over how many hours it will run. And there are more specifications like certain fluids only to be used, like certain medicines only 5% dextrose, few other only normal saline, and sometimes few medications require special IV set known as the Mira filter or codon set. All this has to be brought down very neatly and clearly on the chemotherapy drug chart. Coming to the name of the chemotherapeutics medicine used. So it's very important to write the correct name, and we don't use the company name of the medicine. We should use the appropriate generic name only for the chemotherapeutic medicine, and it has to be written in capital letters. It is good to have chemotherapy drug orders printed. Printed in the sense we can have some of the common regimens which are used commonly printed downline, so that the errors which usually happens by junior doctors prescribing can be minimized. But again, before the drug sheets are printed, make sure the name of the patient and the correct medicine is being ordered. Coming to medicines again, there are many levels of mishaps which can occur. So there are many medicines which are sound alike, they look like and they sound alike. So we have to make sure that we write the correct medicine and instruct and do not administer the wrong medicine. So we should have a list of sound alike and look alike medicines and train our junior staff to know that these are the potential levels of mistakes and errors which can happen during chemotherapy administration. However intelligent one may be, the hospital, the treating physician, doctor, medical, paramedical staff, we are all motivated to do our best for the patients, but it is very important that it has to be carried on, this culture. So we need to create a culture wherein we can prevent chemotherapy errors. So that culture is very important, and that can happen with the continuing medical education. The junior staff, the senior staff, everybody needs to undergo continual training on a regular basis, so that they know what is the scope of chemotherapy errors and how they can minimize. Accountability is something which is very important, and chemotherapy errors happening in onco daycare units has to be made accountable. Creating a happy, healthy and safe working environment, especially in the chemotherapy unit, will try and minimize the chemotherapy errors. Added to it is the continuing medical education.